listeners. I am Dr. Garcia Webb. Welcome. I am a board certified physician in internal medicine, lifestyle medicine, and obesity medicine. And this time is a chance for you to ask any questions you have that come up about weight, what you're confused about. I can't answer personal medical questions, but we can talk about rumors, myths, we can do education, any questions you have generally around weight medicine, prescription questions in general, those types of things. So I will answer as many as I can and in the time that we have. So let's get started. A little bit about me, or really more about you. If you are a person that struggles with your weight, if you're confused or if you're overwhelmed with regards to your weight, I do have a concierge weight medicine practice in Massachusetts. If you are interested in talking more about that, I will give you the info down below. It is a hybrid practice, so I do internal medicine, lifestyle medicine, and obesity medicine, and combine that with the power of life coaching. And so if that is something that you want to talk more about, please reach out to me. And for those people outside of Massachusetts, I do life coaching with regards to goal setting and habit formation. So if you're in Massachusetts, if you're outside of Massachusetts, and you want to talk more, please let me know. Okay, so let's talk about some questions that you had. All right, so let's see. All right, so some people sent these in beforehand, and I'm just gonna go through as many as I can in no particular order. Can you tell the long-term side effects of Mounjaro on the body from Malik G658? Okay, so yeah, I mean, in addition to weight loss, I mean, most people are going to lose, ideally, on average, about 20% of their total body weight long-term. So that's the big long-term effect. But you have to continue using it to achieve that effect. So this is provided that you continue to use it. I mean, you really shouldn't have like severe, long-term side effects. I mean, that's usually the reason that people stop using it. But, long-term effects, one thing you do have to think about is muscle loss. So anytime you lose weight, whether it is, surgery, eating healthy, medication, all of the above, there is a small percentage of the weight that is muscle. And so you really do want to make sure you're counteracting that with strength training, eating protein, that you're really conscious of that. So that is, that's certainly one consequence to think about. And then there's just the side effects from the medication in general. So some people have nausea, vomiting, constipation, diarrhea, fatigue, headaches. Sometimes they go away for people as your body gets used to it, but sometimes they don't. And so for the people that don't, but who really are getting a lot of benefit out of the medication, that could also be a long-term side effect that you're really choosing to, address with potentially another medication. Maybe spacing out your meals a little bit differently. There's ways around it, but certainly some of those side effects for some people don't go away. For some people they do, but we just never know until we try. Okay, great question. Let's see. Okay, does Zofran help with side effects? Yeah, for people who have, okay, so this is from Randy, well, 212. Okay, yeah, does Zofran help? Yes, if people are having nausea or vomiting, it can be a very useful part of an adjunct to your medication. Some people definitely, they know when they're going to get nauseous, they know if they're going to have vomiting, and so they can time it more appropriately. I don't give it to everybody, but it is a great tool to have in your toolkit for those people who know they're going to be nauseous. And some people, like I said, they're just nauseous in the beginning and then their body gets used to it. But it's very nice to have on hand as some of those as needed medications. Okay, and let's see. If people have reflux, Are they a candidate? Some of these questions I'm just kind of depersonalizing. This is from Dejani45. Reflux is one of those things that sometimes it gets better and sometimes it gets worse. So because part of the medication works by slowing the movement of the food through the stomach, you have, the food's there for longer, so there's more time for it to go back up the esophagus. So that's what reflux is. It's going through, your stomach and then your esophagus, and there's that junction when it's going against the current, up against the current in the against gravity. That is going to, so that can be certainly worse for some people. The reflux can be worse. But when people lose weight, a lot of times reflux gets better because you have less of that pressure on the abdomen. So there's this force kind of pushing contents up. So that is just one of those things that you never know until you try. I've definitely had some patients, their reflux gets worse and then goes away. So I don't think it would necessarily eliminate somebody from trying it. Again, this is not to any specific person, and definitely a conversation you should have with your physician, but just having reflux is not a strict contraindication for this medication. Okay, so is it injected? Yes, it is. Mounjaro, I guess it depends on what you're talking about, but Mounjaro is injected and Zepbound is injected. Wegovy and Ozempic are injected, and that's semaglutide. And then liraglutide, which is Saxenda and Victoza, those are injected too. Okay. Is it a bad idea to move up in doses too quickly? Yes, definitely. You really want to go at the recommended pace. You do not want to be escalating too quickly. There's a reason why that we have these, weeks-long intervals in between escalating the dose, because we really want to lessen the chance of side effects for people. So definitely do not, and I think I should have a video up on my channel about this. You do not want to go, like if you're on Wegovy at 0.5, you do not want to jump to the 2.4 dose. That would be so uncomfortable and really hard on your body. And the entire purpose of this medication is to make things, long-term easier on your body. So just be patient, let the medication do its thing. Okay, and then let's see. Other questions. You guys have really good questions. I pay out of pocket every month for tirzepatide. Yes, there are some people that their insurance is not going to cover it, and that's always a bit of a moving target. So I would say, continue to check in with your insurance company. People are also changing insurances all the time for jobs. The formularies for different insurances change as well. And so I think it's definitely an area where there is going to be a lot of movement. I certainly have patients that had to pay out of pocket for a couple months, and then they were able to get it covered because either their insurance decided that it was going to cover that class of medications, or because they changed insurances. And anytime the FDA is approving things for weight, it is always going to help with insurance coverage for those medications. So a lot of people who couldn't get tirzepatide as Mounjaro, they can now get it as Zepbound because it's been FDA approved for weight, which is great news. I think there's going to be changes in terms of Medicare coming up, which would be great. Right now, Medicare really doesn't cover weight medication at all, which is pretty devastating for a lot of people. But hopefully that's changing as well. So more to come. Stay tuned. Let's see. All right. Can you expect nausea every time with your injection? Yeah, that's a great question. Again, can't answer individual medical questions, but some people, they really do, the side effects stick around. Some people, they just have low-grade nausea constantly on these medications, but they really are getting a lot of benefit out of it otherwise. And so we really just work with kind of mitigating the side effect if they decide to continue on the medication. Some people, they, for whatever reason, they just, their bodies kind of have the side effects on a more kind of cyclical nature, so they know, 2 days afterwards, that's when I get the symptoms, and so you can plan a little bit more for the side effects. Some people have the side effects initially in the beginning, and then they just go away. Some people have no side effects. I've definitely had a lot of patients with that. So it is so person dependent, but there's also a lot of wiggle room in terms of how to adjust things for side effects with timing of your food, as needed medications, things like that. Usually the patients I have who stop the medications are the ones that it's just like a full-on food poisoning episode every time they take the medication. So that nausea, vomiting, diarrhea, they're really getting it to a severe extent, and they don't want to continue. And of course, I think that's a logical idea because the risks are really outweighing the benefits at that point. So those are the people that really choose to not continue, but luckily I have not seen too many people with who have that happen for them. All right, so can the side effects cause depression and anxiety? Yeah, I think we're learning a little bit more about this as we have more and more people on the medication. So I usually don't see, clinically mood changes for people, but every once in a while I will have a patient tell me, oh, I did feel a little bit more depressed on this medication. Not to the point where they are severely incapacitated, but they just noticed a fluctuation in their mood. But a lot of times people's mood gets a lot better, especially if people are having really great effects from the medication. So it's definitely something to watch. If I have patients that have more severe mental health issues, it's definitely something that we'll keep a closer eye on. But luckily, at least for me in my clinic, I don't see it very much at all. All right, I'm going to do one more question, and then I'll be back next week, and we can do more questions. Let's see. No particular order. Let's see. Max, I think I already answered that one. Do oral meds take way longer to work, and are they as effective? Great question. Oral meds are, different category. I think when you think about time to work, I would say, they all work over weeks to months. There's really no medication that's gonna, and you don't want a medication that works immediately in terms of losing all your weight. That would be terrible and very uncomfortable. But I would say timeline, and also, with oral medications, you're titrating up, but it's a slightly different schedule, and they all have their own titration schedule. So I guess from a bird's eye view, they don't take that much longer to work. Sometimes you can titrate them up a little bit faster, or there's just less stages for them. So no, I mean, usually the oral medications, you're just not going to get the same extent of weight loss. So, phentermine, you can expect about 5% weight loss. Qsimia, which is phentermine topiramate, it's 5 to 7%. You're just not going to see, for most people, you're not going to see the same average total body weight loss as you would for something like, Mounjaro, which is closer to 20%. You can certainly combine them for the right people. You can do both. That's very patient dependent. But yeah, I would say you're thinking about these in terms of lifelong use. So, one thing I would say for everybody is to just be patient, let the medication do its thing, keep talking with your doctor, don't get discouraged, have the end goal in mind. There's lots of kind of administrative difficulties for people in terms of getting it approved or finding it, or, but just keep your eyes on the prize. And my patients who do that, who are really just have the end goal in mind, makes it a lot easier to weather these inconveniences that come up naturally because of supply issues or insurance issues or things like that. So, okay, that's going to do it for today. I hope this was helpful. Please reach out with any questions you have. I'll do it again next week, and thank you so much for watching.